Hi, I am Dr. Nagarajaiah, Urologist, Andrologist and genital surgeon. I have more than 25 years of experience in urology. I am practicing at Happy Healthy Hospital in Bangalore. Phimosis is nothing but the tight foreskin. Foreskin means the skin which covers the glans penis. So it's called phimosis, wherein normally we should take the skin backwards and clean it daily during bath. If it is not going back, then it's called phimosis. So the commonest cause is, particularly in children, it's a birth, it's congenital. Since childhood they have not have taken the skin back and cleaned. They will come to know only after marriage, say following trying intercourse, they will come to know. The other commonest cause what I am seeing is in my practice is diabetes. Adults, old people, everybody they will have uncontrolled diabetes that causes infection of that foreskin, that causes narrowing of the prepuce and causes phimosis. Sometimes they present with forcefully they will take the foreskin back, but it doesn't come forwards. So in such cases they will present with pain and swelling. So in such cases we under local anesthesia we reduce that and make it come forward. And in diabetes we will ask them to control the diabetes if it controls very good. Otherwise we remove that foreskin so that their diabetes will be controlled, their penile hygiene will be normal. If it is a congenital defect, that is birth defect and doesn't go back, we do what we call circumcision, wherein that foreskin can be removed using different techniques like surgical method, by staplers and by laser. These are the latest technologies available to remove that foreskin and patient will be alright. By removing foreskin, what we can achieve, one is cleanliness of the glans penis, second thing which prevents the future development of the cancer. The second thing is sexual life, no problem, the skin goes back and patient can have normal coitus. The third thing, as I said, in diabetics, good control of the diabetes. Thank you.